Hi, good evening, Dr. Reema. Thank you so much for accepting our invite and talking to our ShopHealthy.in viewers. Um, so every
Yeah, pleasure. Yeah, my pleasure. Yeah.
Thank you. So this is part of our weekly live with one of our onboarded doctors. Guys, Dr. Reema is a MD in pediatrics. She's a practicing pediatrician in Ahmedabad. And along with her practice, she's also very actively running a blog for all the new moms and babies' health. And ShopHealthy, as you know, we are a one-stop shop for all your health and beauty needs. We have recently also launched online doctor consults, and our weekly live is part of that. So thank you, Reema ji. Today you are here to help us understand what is colic in babies, why do they cry, what is the best thing moms can do to start their feed, and please help us
Hmm.
and take us through all these kind of questions that new moms would have.
Yeah. So, colic is kind of, it's one of the reasons why babies cry. So, firstly, there are so many reasons why babies cry. It can be hunger pangs, it can be a soiled diaper, it can be some irritated, part of the clothing, or,
Mhm.
our books mention that it can be out of boredom too.
True.
So kids can get bored and they can cry because of that. So there are so many reasons to it, but coming to my practice, I see moms who are so worried about, and they have read so much about colic in advance that they kind of feel that every cry is colic.
Hmm.
So that is where we need to kind of educate the new moms that not every cry is colic and not every cry is due to hunger. So
Right.
how do you differentiate between the two? So
Hmm.
colic kind of begins around the third week of life. There is kind of gaseous development, or we as doctors also don't know what is the correct reason why some babies have colic, others don't have. Even in twins, like one twin might have, one twin might not have. So
Interesting.
it can be for breastfed babies, it can be for formula fed babies. So there is no reason as to why colic happens, but there is kind of some form of gastric discomfort which the babies feel. And you can see it by a lot of stretching of the body beginning around third week of life. If you kind of press their tummy by putting them on the shoulder, they are kind of relaxed. Their poop is regular, but they're kind of, they look a bit bloated and they are not really comfortable. And around a fixed time every day, something terribly goes wrong, say about 6 p.m. or 7 p.m. or probably midnight 12 to 3, wherein
Mhm.
the baby is unconsolably crying.
Mhm.
So these are a few ways you can pick up colic symptomatically. And there is so many things like there are so many home remedies which you can do if
I was
you
going
are
to ask.
experiencing your baby having colic.
Mhm.
So but let me tell you that none of the remedies are foolproof and work on all babies. So
True.
you have to judge what will work well for you on
Mhm.
your baby. So firstly, putting them on the shoulder, giving them a tummy time, so that their tummy is kind of pressed, there is gaseous relief, ensuring that they are comfortable, putting them upright if they are spitting too much,
Mhm.
and putting them in a head elevated portion if colic is accompanied with a lot of vomiting,
Mhm.
etc. You can do such things. You can rock the baby. You can probably take him or her for a car drive. There are many cultures which believe that we can apply hing, or what you call
Yeah.
aspetida, which we put it in the tadka.
Yeah.
You can put it around the umbilicus. As doctors, we don't agree to it, but I've seen so many moms having the placebo effect out of it, that when I apply hing, it goes away. So if your child is not developing any rash on the tummy when you do it, and if you feel that that's working for your child, you can do it. So that's how you can do it. And
So you're saying the colic cries are generally the way we differentiate between a regular or a colic cry, you're saying, is it would happen at a certain time every day. There would be a pattern to the
yes,
crying.
pattern, and it will happen 3 times a week minimum. So like it's kind of a rule of 3. So starting from 3rd week of life, goes away suddenly at 3rd month,
Oh, wow.
lasting for about 3 hours, 3 times a week, and 3 hours of inconsolable crying. So if that is the case, then you can call your baby a colic baby. Yeah.
Okay. Wow. Okay, that's good to know. So 3 hours is a long time for a baby to keep
Yeah.
crying, but at
Yeah.
least we know that there would be a pattern to it, right?
Pattern to it. Yes, yes,
So for
yes.
such babies, now home remedies, I understand. I mean, walking around, carrying them. How do we give them food? I mean, what is the best way that we begin solids for such babies? I know that they would be a fussy eater.
So no. So colic kind of goes away by 3rd month, three and
Oh,
a half
okay.
months, and we start solids at 6 months.
Got it. Yeah, yeah.
So it's, yeah. So it's and there is no correlation that colic babies grow up to be colic adults. There is no that thing that they will have lifelong some form of gastric discomfort, some acidity. There is no correlation like that.
Okay.
So it's just a pattern, and it kind of goes away.
Okay.
Yeah.
Interesting. So you're saying that no medication is needed, or maybe some symptomatic healing, vagera, just to make them feel at
Yeah,
ease.
so there are so many over-the-counter medicines available, from simple lactase enzyme drops to simethicone, denil oil, all these dill oil, and so many things. So many pediatricians even advise or go for dicyclomine, which is an antispasmodic. But just like colic differs from baby to baby, your treatment protocol kind of differs from pediatrician to pediatrician, because if one pediatrician has seen that certain things work, then he or she would be more inclined to prescribing it. There is no treatment as such of colic.
Okay.
So everything is symptomatic and probably might give you a relief for about 4-5 hours, or probably 4-5 days. But then if your child is bound to have colic, it kind of lasts long. So yeah.
Okay. Okay. All right. So it's basically depending on how the baby responds to which remedy, we can learn from that. And
Yes, yes,
right.
yes, yes.
Okay.
So there, if certain thing works for one mom, it's not necessary that it works. Let it be for one mom. But if one particular things works for the first sibling, it doesn't always work for
Doesn't
the
always.
second. Yeah. So it's
Interesting.
that different. Yeah.
Wow. Okay, so Reema ji, I don't want to move on to the other thing. The question around how to feed them when they're starting their solids. So at colic goes away at about 3 months, and then we'll start solids
Yeah.
at around 5.5 to 6 months, right?
Yes. So earliest probably 5.5. So there are a few signs. Textbook says that it is 6 completed months, but it's it is so layered when you are practicing it in the clinic, because there are so many reasons to it. Like the mother needs to start her job and she cannot pump out 8 hours of milk, and if their child is already on formula but is not getting satisfied, if there is no adequate weight gain, you need to consider so many factors before starting solids. But in general rule, I tell my patients that if your child has doubled the birth weight, the back is kind of straight, there is no kind of leaning forward, like there is some balance of head holding, the child is showing interest in what you are eating. Like if you're eating something, he or she
Yeah.
wants to eat it. If you are kind of, if you're offering food on a spoon, your baby is kind of willing to lick it or suck it or things like that. So that kind of shows the readiness of your baby for complementary feed. Of course, it's a personal choice that even if your child is showing all the signs of being ready at say 5 months, but if you are breastfeeding, if you want to continue exclusive breastfeeding for 6 completed months, that's the perfect way to go. That's the correct way to go. So until and unless you are not having a lot of trouble feeding time, and if you're not working and things like that, it is ideal to wait for 6 completed months.
True. True. I think
So
so, right?
that's
So 6 months ke baad bhi, any particular things to keep in mind when we are starting solids?
So, yeah. So what I advise is it's basically I start with home-based family pot diet. So if you're making dal at home, then you start offering him or her dal. You can give it in a little liquidy consistency, and then probably move on to semi-solids and paste-like consistency, because paste-like, pulp-like consistency is ideal to start with your baby. But there are so many kids who are not able to take the pulp and the paste like consistency. So what you can do is you can start with liquid based diet. So in that dal aati hai, crushed rice aa sakta hai. We as Gujaratis are very fond of rab, so I'll probably try and convert it into a more pan India vocabulary. It's like loose halwa. It's like a liquid based halwa. So we kind of, that's kind of our first foods. And there are so many times, you know, mothers tell me we want to give avocado
Oh yeah,
paste,
yeah.
and we want to,
Applesauce.
yeah. Yeah, so if you eat avocado twice a week, you can give your child that. That's no harm. But I would, of course, there is not a strict no for avocado, but it's things like that. You have to concentrate more on what is comfortable to you and what you are eating daily.
Right.
So yeah, so that's the way, that's the correct way to go. You can start with one meal a day, shift to 2-3 meals a day by say about 7-8 months. And by the time your child is about a year old, he should be just taking milk twice a day, and the rest should be all solids.
Solid. Okay, and I do want to cover this question we received on a DM quickly before we move out of this topic. Somebody had asked us, can salt and sugar be given to babies?
Yeah. So salt, the thing with salt is that all the Google studies which you see are US based, are Western based. We Indian pediatricians have also advised no salt, probably some 5-10 years back. But now coming back to today's thing, we have realized that a bit of salt, especially for a full-term baby delivered at about 3 kgs, the kidneys are formed at 6 months. So you don't really need to limit, you don't need to not give salt. So like aisa nahi hai, you can add it in dal, you can add it in rice. You cannot give pickles and you cannot give papads and salty biscuits. That's a no. But your routine salt intake has to be started at about 6-7 months. That's what I even did for my son. And I advise all my patients that, you know, a bit of salt you need to give. Sugar, I'm against sugar, not till 1 year of age. You can make all things sweet with jaggery and date syrup and things like that. So you can do all of that.
And honey, is that advised or not at that age?
No. So again, honey, with the thing with honey is that there is some kind of, I'll just explain to you in a very simple term, that there is some bacteria in the honey which is dangerous for kids less than a year old.
Okay.
So we don't advise honey too. So honey and sugar are a strict no till 1 year.
Okay, but jaggery is fine, you're saying?
Jaggery is fine. Khajur, dates, say you can make a date syrup and put it in things you want to make it sweet. You can do things like that. Yeah.
Great. I know my baby, my first one, was born in the US. So when you said all these studies are US centric, I really related to it, because we were strictly, they knew that Indian parents have this honey chakhane ka, you know, that ceremony. And they were totally against it. And so we were very clear.
No. So honey and sugar, so we also don't advise. But salt, see, their food is bland. So it's okay kind of if their kids don't grow up liking salt. But I think considering our weather, our culture, our food palette, because then I have patients who have not had salt till 2-3 years of age. And I'm like, what do you feed them? So because my only advice to all moms is that 1 year के बाद आपको घर पे अलग खाना नहीं बनाना पड़ेगा for your baby. So if you have to work towards that
is the goal. Okay.
Yeah. So if you have to cook after his or her, okay, of course, if you're having burger someday or pizza someday, you don't want to give him or her that.
Yeah.
That day, if you put khichdi, is still okay.
Yeah.
But not for, you cannot make breakfast, lunch, dinner separate for them. If you are doing that, means you are going the wrong way.
Correct. Correct. So the goal
Yes.
should be that the baby adjusts to our food habits.
Of course.
And
of
not
course.
a very, not a high salt intake, not sugar, but regular
Yeah.
food habits of the family.
Routine, ghar ka khana. Yeah.
Great. So I think this is exactly what we all as parents should be aware of. Any other, tips that you want to give to new moms, especially when they're starting solids? I remember now, anything I would give, my baby would refuse it the first time, but then I remember my
Yeah.
pediatrician saying you have to offer it a few number of times for the baby.
Yeah.
Isn't
So
it?
you have to offer the child average 15 to 20 times before labeling the child that he or she doesn't like that. So, okay, so I'll give you a simple example. My son, I made him taste chiku around 7 months of age for the first time. And he is 2 months, 2 years and 3 months right now, 3 or 4 months right now. I still offer him chiku every time I bring it home. So,
You're still trying.
yes. So see, it doesn't have to be like you are offering your child, and then you are saying that okay, isko chiku nahi acha lagta hai, but let me try. You are saying that in front of him. So he has, yeah. So what I do is I offer him that, baby, you want chiku? And he will say no. And then I'm like, okay, it's okay. So you still have to keep doing it.
Keep trying, but without putting that thing in their head, that label in their head. That's a very important.
Yes, it's very important. And so there are so many things which my son also doesn't like. So many times when moms tell me no, that she doesn't like dal only, she doesn't like curry only, or she doesn't like khichdi. She has rice, she has dal, she has everything. She doesn't like khichdi. So I'm like, it's okay, no? We also don't like so many things, no?
Correct.
It's the same way with them. So you, of course, you keep offering them, but if they don't like a particular thing, you can't. They are humans, so it's their right for preference too, no?
I know, I agree. Well, this was wonderful. Thank you. I mean, I remember, I wish I had met you earlier. My daughter, I used to go to the pediatrician and say, "Ye kuch nahi khati hai. She's such a fussy eater. I don't know how she's gained weight." And oh my God, the kinds of trauma that new moms go through. It's so good to have you on.
Yeah, so that is the reason I started this blog, because I felt that there are so many things I couldn't communicate in the clinic well, because there is always some patient waiting, and then I have to rush home, and then there are so many issues. Vaccine ke liye aate hain, so I just have to give the vaccine. So see, these topics don't get covered in your routine clinic hours. So that is the reason why I started this blog. Yeah.
Very nice. And that is exactly the reason ShopHealthy has invited doctors. Because again, when they come to our site, they don't see all this. But when they meet you in person, I'm sure they'll want to do more and reach out to you.
Yeah.
Thank you so much.
Also,
yeah. Tell me if you have.
So also so many times, no, I don't like these labels of fussy eaters, picky eaters, and of course there are. Of course, you can do something about it, but so many times, no, we ourselves label our kids so much, no, that if he is ziddi, we call him ziddi. If he is very, he kind of sits at a place, we call that he's dull or whatever. So certain things like this because they are kind of looking for an identity from us. So if we only label them, they are kind of being okay with that identity, that mom, you are a mom, so we are like gods to them in the first 3-4 years. They want it's no matter how much they harass us, they really like treat us as nothing else in the world, only you are there. So then that feeling of course goes away once they go to school, but I think we as a parent have a very high responsibility for it.
I think that is my best takeaway personally, because I have 2 daughters and I call my older one. I always tell her, you're so shy. Why can't you speak up for yourself? And that is a label. And the little one,
Yeah.
I think, why are you always being lazy? I should stop that, right? I mean, that is
Yeah.
exactly what
Yeah.
you're trying to tell us.
Because they are looking, and see what happens if we only tell them a certain things no, and then someone in the school or someone tells them no, and if they say the same thing, they kind of start accepting it.
Interesting.
So
Yeah.
I know it is very tough. It is a very ideal scenario, because even though I talk all these ideal things, I also so many times I go home and I am so fed up. Then I tell him that you are too naughty, or why are you are always like a monkey running around. And I say those things, but but at least if we know that what is correct, then at least the number of times we call them out reduces. So that's the ideal, way to go about
Absolutely.
it.
Conscious parenting. Maybe our next talk with you should be on that, Uh,
Oh, for sure. Yeah.
so wonderful to have you, Dr. Reema. I am so glad
Yeah,
we
same here.
finally got to talk. The live didn't work, but this was really helpful. Thank you.
Yeah, I'm so glad. I'm really sad that we couldn't take up the live questions. But so what we are going to do, guys, you can put in the comments in this IGTV, and I'll be answering them one by one, definitely. So we'll put it that way. So if you have some questions, you can put it in the comments, and I'll reply back.
Done.
Okay.
That's so nice of you. Thank you.
Yeah.
Thank you so much. Have a
Okay.
great one.
Yeah. Bye bye.